As we age, the medical world often becomes both a source of reassurance and a source of fear. We are told to be vigilant, to screen, to test, to monitor. The idea is that early detection saves lives. But what if that concept, which sounds so noble and logical on the surface, starts to unravel as we grow older? What if after the age of 70, some of the tests we're told are routine or essential are actually causing more harm than good? What if the very systems we rely on to protect us in our golden years end up exposing us to unnecessary procedures, anxiety, and even life-threatening complications? In this journey of understanding and awareness, we must look deeply not just at what medicine offers, but at what our aging bodies truly need and don't need. We begin this conversation not from a place of fear, but of wisdom. A kind of wisdom that comes from understanding the true cost of overtesting, overtreatment, and overconcern. The first thing we must grasp is that aging is not a disease. It is a natural, beautiful process. And treating aging like an illness opens the door to a cascade of interventions that may do far more harm than good. When we are younger, the risks of most procedures are lower. Our bodies recover faster. Our immune systems are stronger. But after 70, everything changes. The margins shrink, the side effects grow, the balance tips. Suddenly, a test that might have once been a helpful early warning system becomes a trapdoor into a maze of biopsies, surgeries, and medications that often do little to improve the quality of life, but greatly increase the burden of it. Take, for example, the prostate-specific antigen PSA test for prostate cancer. It's a perfect example of the dilemma we face. For men over 70, this test can often detect slow-growing prostate cancers that would never become dangerous in their lifetime. But once detected, they're hard to ignore. They lead to more tests, more fear, and very often, treatment. Treatment that includes surgery, radiation, and hormonal therapy, each carrying its own risks, such as incontinence, impotence, and other complications that can greatly diminish one's remaining years. And the sad part? Studies have shown that in many cases, these treatments don't actually increase lifespan for older men. In fact, they often reduce quality of life without offering substantial benefits. This is not just true for the PSA test. It's also true for routine colonoscopies in the elderly. After a certain age, typically around 75, the benefits of screening for colorectal cancer begin to decline. The preparation alone can be extremely taxing on older adults, leading to dehydration, dizziness, and in some cases, hospitalization. Not to mention the risks of perforation during the procedure or the burden of finding incidental polyps that may never have caused problems. Yet these findings often lead to surgeries, biopsies, and anxiety. When we start to look closely at these practices, we begin to see a pattern. Medicine, when applied indiscriminately, can be more harmful than healing, especially in the context of aging, where the priorities shift. We're no longer chasing the idea of preventing every possible disease. We are now prioritizing comfort, dignity, independence, and the avoidance of unnecessary suffering. It's also important to talk about mammograms in women over 70. While breast cancer is certainly a concern, the data shows that mammograms in elderly women can often lead to overdiagnosis. Small, slow-growing tumors that would never cause harm get flagged. And once flagged, the psychological and medical domino effect begins. Biopsies, lumpectomies, radiation therapy, all of which carry risks that the body of a 75 or 80-year-old may not handle well. More importantly, studies suggest that for women over 75, routine mammograms do not significantly reduce mortality. Yet the side effects of the screening cascade are all too real. We must ask ourselves, what are we trying to save at that stage of life? Is it years or is it moments? Is it life or is it living? When you're 70 or older, the focus should not just be on survival. It should be on well-being, on quality of life, on peace. Another controversial test in the over 70 population is routine screening for cervical cancer. Pap smears and HPV testing are often continued far beyond the age at which they provide meaningful benefit. Guidelines suggest stopping these tests after age 65 in women with a history of normal results. Yet many elderly women continue to receive them out of habit or overcautiousness. The result? more false positives, more anxiety, and more invasive procedures like colposcopies or even hysterectomies, all of which come with their own set of risks and complications. And perhaps the most telling of all, the full-body scans offered by some private clinics as peace of mind packages. These scans, which include CTs and MRIs of the entire body, are marketed as proactive medicine. But in truth, they are often the gateway to a nightmare. They find things that may never have caused any problem: cysts, nodules, minor degenerative changes. And yet, once seen, they become impossible to unsee. They lead to further tests, sometimes invasive, sometimes harmful, almost always stressful. And for what? For the illusion of control over aging, for the false comfort of knowing everything. But knowledge is not always power. Sometimes it is a burden, especially when that knowledge leads to action that was never needed. The body at 70 is not the body at 40, and our medical decisions must reflect that. Our priorities must evolve. Instead of looking for every possible problem, we should be asking, what improves function? What reduces pain? What increases connection, mobility, laughter, and meaning? What allows a person to live freely, joyfully, and with dignity? Health is not just the absence of disease. It is the presence of wholeness, of vitality, of freedom from unnecessary intervention. After 70, a wise doctor does not just prescribe. They listen, they counsel. They ask about your goals, not just your symptoms. They avoid opening doors that do not need to be opened. They understand that in this stage of life, every decision must be weighed not just by statistics, but by values. This is not to say all testing should stop. Of course not. If symptoms are present, if something changes, if quality of life is affected, then yes, testing is appropriate. But blind screening, routine checkups that lack a clear purpose, and fear-driven testing must be reconsidered. Because at this stage of life, harm can come not just from disease, but from medicine itself. And too often that harm is silent, slow, and irreversible. It steals joy under the guise of prevention. It offers control, but delivers confusion. It promises safety, but sometimes invites suffering. So how do we navigate this? We start by asking questions. We demand informed consent, not just signatures on forms, but true conversations about risks and benefits. We stop being passive recipients of care and become active participants in our own aging journey. We embrace the idea that less can be more, that doing nothing can be a courageous act, that opting out of a test can be the most intelligent medical decision you ever make. Because real health after 70 isn't about chasing every threat. It's about protecting every moment, every smile, every hug, every sunrise. It's about knowing the difference between a life extended and a life enriched, and choosing the latter. In the next part, we will dive deeper into the specific 5 tests that warrant caution, and we will explore not just the science behind their risks, but the human stories, the psychological tolls, and the alternative paths that offer safety, clarity, and peace. Let us now turn our attention to the specific health checkups that commonly continue past the point of usefulness, often well into the 70s and beyond, despite increasing evidence that they may do more harm than good. This exploration is not an argument against medicine. It is a plea for balance, for context, for personalized care over protocol, for reason over reflex, and it begins with an honest look at one of the most routine yet controversial tests administered to older adults, the colonoscopy. Colonoscopies are often regarded as the gold standard in colorectal cancer prevention. But for individuals over the age of 75, particularly those without a family history or previous polyps, the risks often outweigh the benefits. The preparation for the procedure involves powerful laxatives that can cause dehydration, electrolyte imbalances, and weakness in older adults. For those with mobility issues or underlying heart conditions, this alone poses a risk. The procedure itself, while generally safe, carries a small but significant risk of perforation or bleeding. These risks may be minor for a healthy 50-year-old, but for someone in their 70s or 80s, recovery from complications can be lengthy, painful, and even life-threatening. Furthermore, the likelihood of a slow-growing cancer found during such a procedure becoming fatal during one's remaining lifespan is exceedingly low. And yet, once a polyp is found, even one unlikely to ever cause symptoms, It can lead to surgeries, follow-ups, and chronic worry. We must ask ourselves, is the goal to find every possible abnormality or to preserve the highest possible quality of life in the years that remain? The next health checkup we must examine is the routine use of full-body imaging in asymptomatic older adults. Often marketed by private clinics as proactive medicine, these scans, including whole-body MRIs, CTs, and PET scans, are sold as the ultimate in peace of mind. But peace of mind is a fragile promise when the result is the uncovering of harmless abnormalities known as incidentalomas. These incidental findings are so common in full-body scans that they almost become expected. Tiny cysts in the liver, small nodules in the lungs, minor degenerative changes in the spine. Most of these findings have no clinical significance. They do not require treatment. They will never cause symptoms. But once found, they provoke alarm. The mere existence of these findings sets off a chain reaction. Further imaging, specialist referrals, possibly biopsies. Each step adds cost, anxiety, and the potential for harm. Invasive procedures done to investigate benign abnormalities have caused collapsed lungs, infections, and even death. And for what? For finding something that would never have mattered in the first place. Third on the list is the prostate-specific antigen PSA test, which we briefly touched on earlier, but deserves deeper examination. For men over the age of 70, routine PSA testing is no longer recommended by most expert bodies. Why? Because prostate cancer in elderly men is often indolent, meaning it grows so slowly that it would never cause symptoms, let alone death, in the individual's natural lifespan. And yet, once elevated PSA levels are detected, the standard protocol kicks in. Additional blood tests, imaging, biopsies, and in many cases, treatment. The treatments themselves, surgical removal of the prostate, radiation therapy, and hormonal suppression, carry heavy side effects. Urinary incontinence, erectile dysfunction, and chronic fatigue are common outcomes. These side effects do not merely affect the body. They affect self-esteem, relationships, identity, and joy, all for a condition that may have never posed a threat in the first place. The fourth test is the mammogram for women over 75. While breast cancer remains a significant concern, the utility of mammograms declines sharply with age, particularly in those without family history or previous issues. The reason? The balance between benefit and harm shifts. Most breast cancers found in elderly women are slow-growing and unlikely to reduce lifespan. But once discovered through a mammogram, the treatment process unfolds rapidly. Biopsies, surgeries, radiation, and possibly chemotherapy. These treatments can be extremely taxing for older adults, who often already face other health issues. Moreover, the stress and emotional toll of a cancer diagnosis in old age is profound, even if the cancer would never have progressed. Studies show that for women over 75, regular mammograms do not significantly reduce death rates from breast cancer, yet they increase the risk of overdiagnosis and overtreatment. So why do they continue? Often it is inertia. The habit of screening becomes difficult to break. Fear plays a role, as does a deep cultural belief that finding something early is always better. But in the context of aging, that belief becomes dangerous. Sometimes the best action is no action, and the wisest screening is the one that is never performed. The final test we must consider is cervical cancer screening in women over 70, specifically the Pap smear and HPV tests. Guidelines from major health organizations recommend stopping routine cervical cancer screening at age 65 for women with a history of normal tests and low risk. Yet many women in their 70s and 80s continue to undergo these procedures. Why? Often it's due to lack of updated communication from physicians, fear-based marketing, or outdated personal beliefs. The result is unnecessary pelvic exams, discomfort, false positives, and in some cases, surgical interventions. These procedures can lead to bleeding, infections, and even hospitalization in frail elderly women. The burden of screening becomes greater than the benefit. And that's the fundamental principle we must return to again and again. After a certain point, the burden of the test outweighs the burden of the disease. It is not just about detection. It is about wisdom, about knowing when to act and when to let go, when to search and when to be still. Our healthcare system is built around the idea of doing. But aging calls for a different model, the art of being, of observing, of choosing, of knowing that sometimes the best medicine is the one we decline. This is not a call to ignore symptoms or neglect care. Quite the opposite. It is a call to shift focus, from chasing every possible disease to supporting the whole person, from reacting to every abnormality to cultivating resilience, from fearing death to celebrating life. If you or your loved one is over 70, here's what you can do. Start with a conversation. Ask your doctor about the benefits versus the risks of every recommended test. Do not accept the phrase, "just to be safe," without understanding what that safety truly costs. Understand the concept of overdiagnosis, the finding of disease that would never cause harm, and how it applies to aging. Ask yourself what you value most in this phase of life: longevity or quality, certainty or peace, survival or serenity. Use those answers to guide your choices. Advocate for personalized medicine, not protocol-driven routines. Choose doctors who treat people, not guidelines, who ask about your goals, not just your symptoms, who understand that growing older is not a medical emergency, but a sacred process. Remember that wisdom often looks like stillness, that choosing not to know can sometimes be an act of profound clarity, that real peace comes not from scanning every corner of the body, but from listening deeply to it. And above all, know this: you are not a collection of lab results. You are not your scan. You are not your numbers. You are a soul in a body that has carried you through decades of love, loss, triumph, and transformation. You deserve care that honors that. You deserve doctors who know when to hold back. You deserve peace in your decisions. You deserve dignity in your aging. And that starts by recognizing that some health checkups, after a certain age, do more than screen. They steal. They steal time. They steal calm. They steal clarity. And it is your right to say no. It is your right to be informed. It is your right to define health on your terms. Because at the end of the day, the goal is not just to add years to your life, but to add life to your years. And sometimes that means trusting the quiet wisdom of restraint, of acceptance, of knowing when enough is enough.